Aloha, I'm Dr. Taketa-Wong and pleased to be joined today by our associate, Dr. Williams, our women's health specialist. We're going to let you know how to successfully treat a severe form of PMS called PMDD. Dr. Williams, let's start with letting our viewers know the kind of symptoms that are typical with PMDD.
Yeah, so PMDD is a type of PMS that is more severe. So the symptoms are definitely more severe. They can be physical, intense emotional symptoms, which can feel disabling and significantly impair functioning. So it can be physical, it can be mood, and the people that have PMDD can feel very impaired by it.
Right, yeah. And I know for a lot of women, it really makes it hard to function at work, at home, and in life, you know.
Mm.
Um, and and it's really serious, so much so that they may have difficulty being able to work or take care of the family around and during their cycle. So can you tell us like what's going on in the body that causes such intense symptoms?
Yeah, so we've been finding in the research that these women have sensitivity to their own brain chemicals, so their own neurotransmitters, such as serotonin and dopamine. Ovulation, there are shifts in estrogen and progesterone, which it looks as though the brain is responding abnormally to those shifts, causing the symptoms that we see. Inflammation, sleep disruption, blood sugar dysregulation, stress, and trauma can significantly impact these changes as well as genetics. We can think of it as a neurohormonal sensitivity, so brain and hormones, sensitivity to those things.
Yeah, and so now let's turn to the way that regular medicine treats PMDD. So, what kind of approach does regular medicine take?
Conventional medicine generally turns to pharmaceuticals, like SSRIs, which are a type of antidepressant, and birth control. I often find that because conventional medicine is pretty thrifty with blood work, meaning they don't do comprehensive blood work, they miss a lot of things like what we mentioned earlier, such as the blood sugar imbalances, nutritional status, inflammation, and stress, as well as thyroid imbalances, which can contribute to the symptoms.
Yeah, and I know a lot of our patients come in feeling sometimes really gaslit, and they feel like nobody's they're they're just offered birth control pills, but then it's like, okay, but then if they want to get pregnant or if they have side effects with it, then even asking about those things, and there's often not much, I guess, that's really offered as, or anything that's offered as an alternative. um,
Yeah. It's
uh,
really about the short-term fix and not really looking for the root cause or the long-term effects from the pharmaceuticals. Because often then I find that people maybe went on an SSRI and did get a little better, but now they're wanting to get off of it, and it's difficult for them to come off of it.
right.
So, yeah, that's where we come in.
Yeah. So thank you. And then, I mean, next we're going to talk about the way naturopathic medicine treats PMDD symptoms, and then give you some case histories. But first, when it comes to the best treatment, I think it's just really important to emphasize that everyone has a different makeup. So each person really needs individually tailored medical solutions. So for our viewers, you can call our office to schedule a no-charge medical consultation with me, so that I can talk with you personally about your health concerns. The phone and other contact information is on our Facebook page. Dr. Williams is part of our practice, so if you're interested in working with her or seeing her for PMDD or any other types of conditions as well, then the first step is scheduling a no-charge consultation with our office. And then also, if you purchase vitamins, minerals, herbs, and such, please visit our online supplement store, which is on our website at drtaketa-wong.com. That's drtaketa-wong.com. So there's a 20% discount store-wide. You can trust the products, and then all the net proceeds go to helping children with special needs with their medical treatment. And a link is in the post with the video. When it comes to naturopathic medicine, there's a lot of different things that we're doing, really looking for underlying causes. We frequently start with a healing food plan that's tailored to each individual patient. So can you talk about some of the approaches to food for PMDD, those with, these extreme PMS symptoms?
Yes, food can make a big difference, and even in just the way we eat. So, eating regularly can be really helpful to avoid blood sugar highs and lows, which can make symptoms worse. And generally, when our blood sugar is high or low, we don't really feel good. And that can translate to mood changes and lots of other things. So, eating regularly, not restricting, or for some women, fasting, and having healthy protein, healthy fats, and carbs at each meal can be really helpful. Protein, in particular, helps prevent blood sugar swings, but it also helps that those neurotransmitters, so those brain chemical production, to achieve healthy brain chemical levels. We have things like omega 3s, which is found in things like salmon. Chocolate is calming, and calcium rich foods like dairy. If you cannot have dairy, then things like sardines and tofu are good places to get calcium. So nutrient rich diet, anti-inflammatory type of diet, is really helpful for a lot of women.
Yeah, thank you. Um, and then to further treat symptoms, these are laboratory tested, health promoting vitamins, minerals, nutrient supplements, herbs, peptides, low dose immunotherapy, and other healing remedies from the US and all over the world. So, can you tell our viewers a little bit more about your naturopathic protocols?
Sure. So sometimes we need more nutrient support than what is found in food. So often, to fill in nutritional gaps in the diet, herbal supplements such as maca or chaste tree are examples of herbal medicine for women who suffer from PMS and PMDD. But there's so many. So there's lots of other herbal medicine. Since we do comprehensive blood work often in this population, I find iron deficiency on blood work, vitamin D deficiency. So these are all things that we can help with diet first and foremost, but sometimes we need additional support in the form of supplementation.
Yeah, and I know that you've treated many, many women, with women's
Mhm.
health conditions. So, how about giving our viewers a few examples of some of these cases?
Sure, yeah. So, um, mid-20s female, she was things before her period that were absolutely debilitating. And I did some testing, and this is an example where I did find low iron, low vitamin D. And we also talked about her stress levels. I was able to get her feeling better with prescribing vitamin B6, which is great for women's hormones, plus calcium, iron, and vitamin D, which are all helpful in PMDD, while she was doing meditation and focused on going out in nature when she was out of the office. So we did things in the office, and then she continued with the treatment plan outside of the office, which helped with her success in the program.
Yeah,
And she got a lot better.
yeah, that's great. So, can you share a little bit in terms of like how she was doing after, you'd worked
Yeah,
with
so
her?
she came in a few months experience. She had no longer had debilitating mood swings before her period. And she had noted that even her boyfriend had noticed that she was feeling better. So
Yeah,
yeah, the mood swings all but disappeared.
yeah,
And sometimes those takes a toll on our hormonal health.
right, yeah. Um, and yeah, any other cases that you
Mhm.
had to share?
So, mid-30s woman, she was coming in for depression and excessive weeping. So she was crying more than usual. And this had gradually gotten worse over time. So she was at a place where she just wanted to know what was going on. And so for her, I did a neurotransmitter test, and we offered neurotransmitter testing, which does look at things like serotonin, dopamine, and GABA, and much more. Also includes cortisol, which I really like to see. And those levels were abnormal. So we focused on getting her enough calories and protein so that those precursor, so protein is a precursor to our neurotransmitter. So if we're not having enough protein, we might find that those levels are low. So we had her focus on getting enough calories, enough protein. And at the time, she was also over exercising, which put a big strain on her hormones. And let's see, for her, we did actually did homeopathic medicine with her. So there's some great remedies for women's hormonal health and balancing, and sepia is one that is very common, that I commonly use with women, that helps tremendously, especially with the weeping and the depression. And so within a few months, she was feeling a lot better. She had significantly less crying and depression before her periods. And before she had come in, there wasn't really a reason for it, right? Like, it was like one of those things where she was like, I don't know why I feel this way. Like, feel like everything's in place. And, there was just this, for women, we're like, why is this happening? But it was the neurotransmitters. So once we addressed those significantly through also some supplements, that helped her as well.
Yeah, so that's great. So, and any other cases that
I have one more. We
Yeah.
have time.
Yeah.
So I had a 42-year-old woman, and she had significant anxiety. And this was also leading up to her period. And so for her, we got her started on cyclical progesterone to help with that anxiety. And so we used bioidentical hormone therapy, particularly that progesterone, because when we take progesterone orally, because it's being metabolized through the liver, it actually produces a calming compound. And so when we don't have enough progesterone as we get older, when we supplement with it, it can have this profound calming effect, and it can help with insomnia as well. And for some people, they don't even know they weren't sleeping well or they had anxiety until they feel the result. And she, after a few months, had significant improvement in her anxiety, and understanding where it was coming from, but also getting relief from it so that she could function in her day-to-day life and take care of her family and herself.
Yeah, that's great. So, and then, where is she at? Where is she at after, you went through, I mean, I know you said she's a lot better.
Yeah, she's significantly better. So her anxiety has decreased, and she still comes in regularly for acupuncture to help with it as well. Because of course, there's going to be times where anxiety comes up more often if we have changes in life or other things going on. And so she helps manage it with when it does come up with acupuncture.
Yeah, that's great. And I think that's one thing that's most people don't even know about acupuncture for hormonal imbalances and for, women's health and things like that. I think most people just think about acupuncture with back pain or neck pain, and it can definitely help with that. But acupuncture can be very helpful. I know it helped me with hormonal imbalances and things like that, and for many other things, even mental, emotional health, anxiety, depression. So, knowing that acupuncture can be far more versatile and help with a lot more things than just neck pain or back pain.
It really helps with hormonal health, and what I tell patients is getting into that rest and digest state, that nervous system state that we heal in. And if our day-to-day life doesn't allow us to get into the healing state, acupuncture can help us practice getting into that state while you're doing meditation or yoga or Tai Chi outside the office. So I find it invaluable.
Yeah. So thanks to Dr. Williams for all of her wisdom and skill, and for explaining how we treat a severe form of PMS called PMDD. So I trust our conversation about women's health has been valuable for you. With our no-charge medical consultation, you're welcome to talk with me personally about any health concerns that you may have, so that you too can be empowered with your health. All the contact information is on our Facebook page. And if you purchase vitamins, minerals, herbs, and such, please visit our online supplement store, which is on our website at drtaketa-wong.com. There's a 20% discount store-wide. You can trust the products, and all the net proceeds go to helping children with special needs with their medical treatment. And a link is in the post with this video. So mahalo, and I look forward to seeing you in 2 weeks. Aloha.